All right, so thanks again for doing this. My first question to you is tell the audience a little bit about yourself and how you started in the community.
Yeah, so my name is Christina Mattschei. I'm currently working as a therapist, but in the beginning of my career, I was working as a community integration specialist, which included roles like cognitive rehabilitation therapy, job coaching, and even just supervising other colleagues who were doing the same roles. And most of the people that I was working with at the time had traumatic brain injury. The company that I worked for specialized in that. But in addition to that, I had clients that had developmental disorders, even serious mental illness like schizophrenia. And I would basically go into their homes, home and community, and work with people in their own environment. So it would be helping them, if they were on a diet, helping them manage their diet, buy groceries, budgeting, making food, if they had jobs, whether they were volunteered or paid jobs, I would go with them to their jobs as a job coach and just, I would do assessments, find out if there was anything that, maybe they could do differently or better. If they had any, deficits that were getting in the way or any strengths that could be built upon, and then just kind of acting as a liaison with management and their supervisor about, any struggles that they were having. um, yeah, so that was pretty much the work that I did for like 7 years. And then I went back to grad school and studied neuropsychological um, research and counseling, and then started to kind of more focus on the counseling aspect of things. So I still have clients that have traumatic brain injury and autism, but mostly nowadays OCD, anxiety, trauma, depression, body focused repetitive behaviors, things like that.
Yeah, so that was kind of my next question, what do you do in your current role? What's the day-to-day like?
Yeah, so well, I have two jobs. So I do work for an insurance company, a mental health insurance company, helping people that have insurance get access to care. So going over their benefits with them, helping them find a provider, and then when I see clients directly, most of my clients have OCD right now. That's one of the areas that I'm really interested in. It's completely virtual. And my training is in cognitive behavioral therapy and dialectical behavioral therapy. So for OCD, we're doing exposure, um, which is basically identifying whatever the fears are and then, systematically working through those, starting off with the smallest ones and, working up to bigger and bigger ones. But I do also use cognitive behavioral approaches with other forms of anxiety, uh, trauma, depression, ADHD, couples, families, all ages.
Mm-hmm. Because see that also was my next question because yeah, what are some of the methods or approaches that you use when working with patients?
Yeah, so from a cognitive behavioral perspective, I love exposure therapy because it is the most proven evidence-based method for OCD symptoms. And interestingly enough, it also is helpful for all forms of OCD. So it can be used for generalized anxiety, trauma, pretty much all different forms of anxiety. And that's kind of my go-to because of that. I want to make sure that people are getting what's going to be the most helpful the most quickly. But there's other things that I'll bring into that too. I really love mindfulness, relaxation strategies. So the DBT is a lot of that mindfulness practice. And then, for depression, it would be more of like a behavioral activation approach. So looking at the way that thoughts, behaviors, and feelings are all related, and then how we can, shift, if we start to shift one of those areas, how it can shift all three.
Mm-hmm. My next question is, what impact does doing this kind of work have, not just on yourself as a clinician, but also how does doing this work impact the greater community?
So specifically for the counseling and the CBT approaches, I think that it impacts the community and that the OCD specifically can be really debilitating. people that are dealing with OCD can find that it impacts their work, that it impacts quality of life because, if you're having obsessive intrusive thoughts and constantly having to do things to cope with them, which are the compulsions, it can take up so much time and it doesn't feel good and it can really hold a person back. And so, if I can help as many people as possible realize that there is a way to deal with OCD that actually does work, right? And it's going to work differently for everybody because I'm not saying that it can be cured, right? Usually, it's a lifelong thing that a person is dealing with, but everybody has intrusive thoughts, and it's just with OCD they're a little bit stickier. And if I can help as many people as possible learn to cope with them better, it just makes everybody that is working through this enjoy life better and be able to get more done and do more of the things that they want to do. So um, yeah, I really appreciate doing this work and being able to help as many people as possible to live a better life with OCD.
Mm-hmm. To kind of wrap this up, what can people take away from this conversation? How can this doing this type of work, really get students, who are wanting to get into the psychology realm? What advice, tools, tips, strategies can you give them to sort of say, hey, this is a really great profession, but it's also a demanding one?
Yeah, yeah. So exactly. It is a really great profession. It is also a demanding one. I would say I think it's really important to have a very clear picture of what you want. And of course, that takes time, right? You kind of don't really know what you want unless you start taking steps towards it. But I've found that if you know what kind of population you want to work with, if you develop maybe a specific modality that you want to specialize in, and explore whether you want to do virtual or in person or a combination of both. How you want to work on getting your licensure hours, which is a big thing to think about too, right? As soon as you finish school, you've got to work on those licensure hours, and there's a lot of different choices there as well. So I think getting a clear picture of what you want, and there are so many different options. So I think as long as you're very clear and very intentional about that, this can be so rewarding and such an amazing job.
All right, here we go. Okay.